Hello, this is Dr. Laura Tigler. Welcome to my channel. This channel is meant to provide medical information. It's not meant to provide specific medical advice, so please do see your primary care provider or your doctor to obtain medical advice that's specific for your medical needs. Also, at the end of the medical information, I will be giving some spiritual information. If you do not want to stay for that portion of the video, I will let you know once the medical information is finished, and at that point you can simply click away. But first, please do like and subscribe. So today we're going to talk about albuterol. Albuterol is a medication that's typically used for diseases such as asthma or COPD. Previously, I did a video on COPD. It was called COPD The Basics. So this is a subsequent video. And we're just going to talk about one medication today. It's called albuterol in the United States. The same chemical structure is called salbutamol around the rest of the world. The reason that we have a different name is because the United States has something called United States Adopted Name. So we might name a chemical structure something different than the rest of the world, but it's still worldwide understood to be a bona fide name for that chemical structure. In fact, we have something called INN, International Non-Proprietary Name. So albuterol and salbutamol are both INNs, International Non-Proprietary Names, so that generic manufacturers, doctors, scientists, patients, advertisers, everybody has to use the exact right international non-proprietary name, whether it's albuterol in the United States or salbutamol in the rest of the world. And whether it's the albuterol or the salbutamol in the rest of the world, both of those names are actually just contractions of the very long chemical name. So it's not like something creative or describing what illness it's used for. It's really just a contraction of the long name. And so that's where we get the names from. So AL is describing a certain part of the molecule, and but is describing another part of the molecule, and EROL, EROL is describing another part of the molecule. Same with salbutamol. It's just like shortening the chemical name. Okay, so that's some information about international non-proprietary names, how the United States does it a bit different, but it's all the same chemical structure. And remember that this naming system, it's really used for the public good, is to promote safety. So that way, we doctors, we try to use the generic names. We might sometimes use the brand name for communication purposes, but we generally try to use the international non-proprietary name when we speak with patients or we're doing some sort of communication. Okay, so now I'm going to show you the chemical structure, and I encourage you to go to your favorite search engine and type in albuterol chemical structure. In fact, you can do this with any medication or search anything that you're taking into your body and learn more about its chemistry. It's okay to go down that rabbit hole. I really encourage you to do that. Of course, I'm a bit geeky and I really enjoy it, but if you're taking a medication on a regular basis, you really should know a lot about that medication. Okay, so I haven't gotten to the point where I screen share yet or use other type of software to record these videos, so I went ahead and wrote out the chemical structure, and at the very bottom, that's actually the chemical name. That's 4-bracket 2-parentheses tert-butyl amino ((1) hydroxy ethyl ((2) hydroxymethyl ((phenol). Okay, and then in the middle up here, this is a hexagon. It's got 6 sides. And see how at the top here, I wrote hex just means 6 in Greek. That's where it comes from. And see, when you learned all those shapes in school, this comes in handy. Okay, there's 3 extensions off of this benzene ring. That's what we call it. So this is a benzene ring, and it's special because it has a phenol group. But anyway, it's just a ring. 6-sided. I'm the one that put that circle in there. That's just delineating for you that this is a very stable benzene ring, and the electrons, it's called electron delocalization. They can kind of float around and attach to whatever other atom in this ring that they want to. So that's how stable it is. Okay, and then over here, there's 2 extensions down here. That see that hydrogen atom and the oxygen atom, and then the same up here, off to the side here. Okay, so these 3 extensions, you see this one up here with the squiggly line, they help this molecule, this chemical structure, bind, let me see, I'm working here, to our chemical structure in our body, and we call that the beta-2 adrenergic receptor. And you see up here that that funny looking B, that's an italicized capital B. That's our symbol for beta, beta-2 adrenergic receptor. So our molecule binds with this molecule, and it affects bronchodilation. So this albuterol molecule landed inside the bronchial tube. It connected through our cell membrane via this receptor, and it told various machinations in the cell, oh, would you please dilate this smooth muscle for me? I want this muscle, this smooth muscle cell, to dilate the bronchial tube. And then what happens is you have the bronchial tube and it gets bigger, yay! And the effect of the albuterol, or that very long chemical name, or the salbutamol, if you're listening in a different country, lasts for about 4 to 6 hours. It's not permanent, but thankfully we have that. Okay, so now I'm going to talk about some uses, side effects, etc., and also some instruction on how to use the inhaler. So let me go down a bit, and you can look this up for yourself. You can look up what special precautions should you follow. It did mention if you're taking medications such as antidepressants like amitriptyline, desipramine, doxepin, nortriptyline, other medications like blood pressure medications, that you need to let your doctor know. Okay, and then before I get started with some of these instructions and uses, we generally like to give albuterol, think of it topically. Okay, so I have my arm here, and if I have a rash, I'm going to put cream topically on top of this epithelial membrane, this skin tissue, this surface. So in a way, if we have the bronchial tube and medication is inhaled and it lands on the surface, the inner surface of that tube, that's also topical. So it's getting absorbed or working at the surface of that membrane. And I just showed you the albuterol chemical structure is combining with a beta-2 adrenergic receptor at that surface level, and it tells the cells right there at the surface to do something, in this case to dilate the bronchial tube. And that's the same if we're putting like a cream on our skin here. It's working right there at the surface. Like if I have a rash there, or I'm trying to prevent an infection, I might put antibiotic ointment there. It's working right there at the surface. So we really prefer to give topical albuterol. Systemic albuterol would be a pill or even a syrup that you swallow, and it's going down into your GI tract and then you're absorbing it. But we don't prefer that because that means that that medication, that same chemical structure, is going to all parts of your body, and we don't want to have effects from that medication in other parts of your body. All we want to do is open up the bronchial tubes. So we do prefer the topical, but there are tablets and syrup for the albuterol. Okay, side effects that this medication can cause: nervousness, shakiness, dizziness, headache, uncontrollable shaking of a part of the body, usually it's the hands, muscle cramps, excessive motion or activity, sudden changes in mood, nosebleed, nausea, increased or decreased appetite, difficulty falling asleep or staying asleep, and pale skin. I've been practicing almost 25 years. If you take this correctly, and we prefer it be topical, not the systemic, then you should have no side effects. If you do have serious effects such as chest pain, fever, fast pounding, or irregular heartbeat, make sure you seek medical care immediately. Okay, and I have some other fun things I want to go over. It doesn't have the instructions on how to do the inhaler right here, but let me go over what I've memorized for you. Okay, so I'm going to show you the typical albuterol inhaler. Oh, I'm going to take that glare out. And you see how that's a canister? It's red, and then right here there's a cap. We call that the dust cap. Make sure you keep that on because you don't want dust and dirt to go inside this holder. The medicine will come out, this mouthpiece underneath this dust cap, and it jets out into your respiratory system. So you don't want dirt jetting down into, pushed down into your respiratory system. So make sure you keep this closed and this inhaler in a safe, dry, clean place and not an extreme temperature. And then up here, this right here, I guess I'll use my pointer finger. That's the actual canister where the medicine is contained, and it clicks down into this holder. And then you might just call this a puffer. Okay. So this is what it might typically look like. And then remember, it is L-shape. You're going to take that dust cap off. The instructions will say to put it into your mouth and put your lips around it, but you can sometimes still get some good effect if you keep it 1 inch away from your mouth. But ideally, you're going to use a spacer. So the spacer is usually like this long. It's a clear tube, and you put it to the mouthpiece. So this is the L-shaped puffer, and this is the spacer right here. And what that is used for, when you press the button at the top in the canister, the medicine squirts out. I shouldn't say squirt, it pushes out. So it's aerosolized, or like a vapor or mist, so to speak. The medicine goes really fast, and the large particles will land on the surface area of the spacer. And that's good, because a lot of times if you don't use a spacer, the large particles will land in the cheeks. We call that the buccal mucosa inside there. It can even land in the oral cavity and have effect, but mostly if it lands in the cheeks or buccal mucosa, it can get absorbed into your whole body, and then that I already listed some of the serious side effects. You don't want to have effects in your body. You just want it to be topical, right on the surface of the bronchial tube. So it really is a good idea to use a spacer. And then the small particles will get entrained or sucked down into your lungs where we want them to be, the bronchial tubes. Okay, so that's how it works. I mentioned that I'm going to go over a couple safety issues. So for the L-shaped inhaler, that canister, it belongs to that holder. Once that medicine is gone out of that canister, you don't want to take that canister out and put another canister in. That will not work. Nowadays, a lot of the canisters and the whole apparatus, somewhere on this apparatus, this L-shaped puffer, it'll have the number of inhalations. Typically for albuterol, you might have anywhere from 60 to 200 inhalations, and that's very handy. Once you're done with all the inhalations, even if you can detect that there's some medicine in there, like you shake it and you can feel that there is some medicine in the inhaler, do not use it anymore, because then you're not certain about whether or not you're getting the right dose, and that's not helpful. So you want to get a refill. So once you're done with the inhalations, you're done with that medication, okay? And then you might have learned somewhere that you can float it, and depending on the density, you can tell how much medicine is left in there. But that's the same problem. You don't want to use something that has expired or has gone past the inhalations where you can count on the right dose of medicine. So you don't have to do any of those tricks. And make sure you clean your puffer or inhaler according to instructions. You want to keep it clean, because if dirt gets in, that dust cap has to be on. If dirt gets in, that could also put some contaminants down to your respiratory tract, and that is not good. So I'm going to shift over to the nebulization method of giving you the albuterol. So the medicine comes to you in a liquid form. It's not in a canister. It's in a liquid, and it's in these tiny little vials that are shaped as small as my pinky finger here. And When you do take that out of the blister pack, just be careful. You just want to carefully take one vial off that pack. If you're too aggressive or fast, you might accidentally open 2 vials, and that's going to waste medicine. So you can only take 1 vial per dose. So you're going to take your vial off, and then you have a plastic cup, let's say, or reservoir, and then you're going to open up the medication, the vial. You're going to pour that liquid, should be clear, colorless, into that little cup or reservoir. You're going to attach the mask or mouthpiece. Now, there are cases where you don't have to put it right on the face or the tube right in the mouth. If the medication's right near your nose and mouth and you're breathing in, remember, your nose is going to suck in or entrain some of that medication, but ideally you use it as directed. Okay, so you have the reservoir, you have the mouthpiece or the mask attached. So you're going to, like that. And then attached to the cup, there's going to be like a long tubing, a really, really long snake, long tubing. And that tube will attach to the nebulizer machine, which you typically call compressor. You can do all this yourself. And once you're ready, you have everything ready, you can press the compressor, press it on. And then typically you need that compressor or nebulizer machine to be on 5 to 15 minutes. 10 minutes is usually the duration of time needed. If you get side effects or problems, stop the treatment. You do not have to keep going past 15 minutes by any means. And that medication is going into your bronchial tubes, and you feel like you can breathe better. Don't mix other liquid medicines into the reservoir unless your pharmacist or doctor have told you that it is okay to do so. A lot of times we do prescribe a combination liquid medicine, albuterol, with something else. So it might be already mixed, and that's perfectly okay, obviously. So you're going to use the nebulizer machine or compressor or the inhaler every 4 to 6 hours as needed while awake. If you're breathing well and you're sleeping, you don't have to wake yourself up to give yourself a dose generally. And please do see your doctor or call your doctor if you have any problems. If you have any severe problems, go to the emergency room. Remember, this video is meant to give general medical information. It's not meant to give specific medical advice. So you really have to do your due diligence. Read, and see your doctor or provider regularly and get instructions that are tailored specifically for you. Okay, so this is the end of the medical information. I hope you enjoyed our bit of a delve into chemistry. I would love to do more chemistry. If you guys want that, put that in the comments. But I'm going to move on to spiritual information now. So if you don't want to hear that portion of the video, this is the time to click away. But first, please do like and subscribe. Okay, so my viewers know I like to let you know that I am a devout Christian and I am saved. And the reason I mention that is because I've noticed through almost 25 years of practice that patients who have a religious discipline, a religion, a faith, or even close family ties, they have a bigger story in their life, bigger than just their personal story, that gives them a lot of meaning. Those patients seem to do better. And the scientific literature does bear that out to some degree. But I also have the opinion that if you're not saved, you're lost, and that you need to be saved. And I totally understand that some patients listening to this might say to themselves, what is she talking about? I don't feel lost. But that's where my first book comes in. I'm a doctor. I'm also a military spouse, if you can relate to that. But I'm also an author. And the first book I wrote is nonfiction. It's theological in nature. And it explains the whole process of being lost and being saved and why it's so important to be saved. So I encourage you to read that book. You can go to Amazon, type in "You're Saved," Laura Tigler, my name, and you can purchase the book, or you can go to my author website to learn more. It's in the description of this channel. You could read the Bible directly. You could go to the Gospels and the New Testament. I always loved Matthew. I also loved John, but there's also Luke and Mark. You could go to a very trusted family member or friend who is quite spiritual in your opinion. and begin your journey there. I like to call that my point of contact, the first person that I trusted, that first step I took on my spiritual journey. It's so important to take that step. And I would say again, it's so important to be saved. Okay, and then the second book I wrote is meant for entertainment. Usually at the end of the videos, I say a prayer, but today I just want to end it with a tiny excerpt from the second book. The second book is meant to entertain. It's to me a work of art. It's purely creative. It was a joy writing it. It was very fun. I felt no restrictions, and that's how I want you to take it. It's just to take as entertainment. And you might read it, say, at bedtime or on a vacation. It's not meant for children, however. It does have adult content. So I am just going to read a little portion of that book. I'm just going to open it randomly. Why, yes, Sujita was my sister. Oh, Laura now realized the truth. Sujita had had a sister. No wonder the resemblance was that strong. May I ask what your name is? My name is Laura. This time Laura extended her hand out to give a proper introduction. Both ladies were now past their initial shock. So nice to meet you, Laura. My name is Sujata. They both smiled at that. Some parents like to have fun with kids' names. It must have been a bit confusing growing up. Maybe they had nicknames to help avoid chaos in the house. Laura liked talking with Sujata. They became fast friends. They both realized they were famished and decided to eat at the Thai restaurant located in the same strip mall. When Laura had texted Adam, he knew that this was no coincidence, meeting Sujita's sister. He agreed to watch the boys as long as she needed to be away. Plus, he let Laura know that Disneyland was fantastic, and he was enjoying himself immensely. So that's my second book. It has space travel, time travel, aliens. It intertwines Christianity and Hinduism. If you're open-minded and would like to have a bit of fun, I do suggest this book, and you can go to Amazon and purchase this one, An Impossible Situation. I promise you I wrote it before the Oppenheimer movie. And yes, Oppenheimer does play a significant role in this book. So I hope you enjoy it. And I hope you've enjoyed this video. And I'll see you next time.